Thank you, Chair. I'd like to thank the European Commission and my dear friend Wolfgang Philipp for the invitation to be here today. After all we've heard these last 2 days on chronic diseases, we must put all European politicians on board. To do this, we must be clear on 3 simple facts. Chronic diseases are responsible for 86% of deaths in our region. They are the main cause of disability and morbidity. We spend more than 700 billion euros a year on chronic diseases, a value that tends to grow year after year. So here's my first key message. If these simple facts don't put your national politicians on board, then fire them, because they're not doing their jobs. Ladies and gentlemen, health policy can be divided in 3 eras. The pre-scientific era, when basically we didn't know what we were doing. The scientific era that boomed in the 20th century, and we started to have sound evidence on how to solve health problems. And now, our current era, the post-scientific era, in which, despite the fact that we have the power of science on our side, social factors like discrimination, poverty, and costs are blocking our action. That's where politics plays a central role to overcome these barriers and to put science at the service of the people. And our main problem is crystal clear. In most European countries, we don't have health ministries. We have disease ministries. Just look at the numbers. 97% is spent on treatment, only 3% or less is spent on prevention. It is clear that we need to change the way we think. If we know prevention works, what are we waiting for to establish clear goals? Tell all member states that they must invest at least 10% of their budgets into prevention, and if they don't have access to European funds. It's simple, but it's effective. When it comes to health care policies, the days of business as usual are over. Health technologies are just going to get more and more expensive, and the European population is just going to get older. We need a value-based healthcare system in which health outcomes become our main endpoint. So let me be blunt. As a medical doctor, I don't care if patients have access to doctor appointments or to meds or to surgical interventions, if at the end of the day they are still suffering and they're still sick. We need to shift from the current bureaucratic management philosophy towards a true clinical and patient-centered system that can make people healthier. To do so, we need to take a personalized approach on chronic diseases, and that means bringing the patients into the decision process and to give them clear responsibilities. When we have people who are sick, they are not working. That has a direct impact on our economic situation, on our productivity index, and so we need to change our focus from just looking at health as an expenditure, but more as health as an investment that can help to create a sustainable future. Coming to the end of my first intervention, I would like to leave 4 rules of thumb on how European institutions can help invert the chronic diseases pandemic. First rule, if it's preventable, prevent it. Keep pushing for effective preventive measures like screening, like vaccination, like active aging. Give more power to the ECDC and fight all anti-health lobbies head on. WHO stated that the tobacco industry is public enemy number 1. I agree. But here in Europe, even after looking at the numbers we saw these last 2 days, we have to acknowledge that the alcohol industry is also a public enemy. It is unacceptable the lack of basic changes in some countries, such as the rise of minimum age for drinking or visible health warning labels. Second rule, if it's curable, cure it. The European Medicine Agency and other HTA bodies need to push for what is truly cost-effective. If the science is clear, then be clear about the science. For example, we are at the verge of being able to cure hepatitis C, a fatal, chronic disease with enormous health costs. What is EMA planning to do about it? Third rule, empower citizens. Don't think you can use the same strategy for all chronic diseases. From prevention to treatment and care, we need to individualize our approaches and value citizens' capacities to take decisions. For example, we saw just yesterday that traffic light labeling healthy food is effective, so let's start labeling our food in our region. Lastly, the fourth rule, the Commission must fight for health in all policies. And there is no other way to do it except by giving more power to health ministries. what the Commission has to do is to sit the health ministers and the finance ministers, put them together in a room, and make sure they don't leave the room until it is clear that the health ministries are in charge for health. And then you bring in the education ministers with the health ministers, and you don't let them leave until you have effective, clear, working health education in your countries. Then you bring in the social security minister, and you make sure that poverty and fighting inequalities is at the top of the agenda, and so on. Ladies and gentlemen, I know this is all easier said than done, but have no doubt, a healthier future in the European region depends on our actions today. And so my final word is to Commissioner Borg and to the rest of his team. You've done a great job fighting for health. Let's take that fight a beat forward and set bold goals. You have a room of soldiers in this room, me included, to fight for a healthier Europe. Let's start making real changes. Thank you very much.